breath can give you important clues about the health of your kidneys. Kidney disease is something that I see and treat every day. It's more common than you think, and it's often hiding in plain sight. In fact, it's estimated that up to 90% of people with chronic kidney disease don't even know they have it. This is a major problem because if we can catch kidney disease early, we can usually treat the root cause and prevent further damage. So today, I'm going to show you the top 17 signs of chronic kidney disease, which may just save your kidneys and your life. These two bean-shaped organs sit on either side of your lower back, just under your ribs. Now, most people think of kidneys as filters. And it's true, they filter out toxins and get rid of them in your urine. But they do so much more than that. They help regulate levels of salt, potassium, and other electrolytes. They balance the acid levels in your blood. They even control your hemoglobin levels and help maintain your bone health. So the question is, how would you know if these delicate, sophisticated organs were in trouble? Let's start with foamy urine. And I don't mean a few bubbles that disappear within seconds. I'm talking about a true layer of dense white foam that sticks around, similar to what you might see on top of a beer. This is a sign that a protein from your blood, called albumin, is leaking into your urine. And to understand how it gets through and what it means for your kidneys, let's take a closer look. This is a glomerulus. Just one of about 1 million tiny filters that make up each of your kidneys. It's a tiny bundle of blood vessels so narrow that red blood cells have to squeeze through single file. But we need to look even closer. Now you can see what looks like tiny little hairs all over the surface of the blood vessel. These are actually tiny tentacles that extend from specialized cells called podocytes, and they create a living filter. But podocytes are sensitive to sugar, high blood pressure, and other toxins. And when they get damaged, those tentacles flatten, and that leads to gaps opening in the filter, allowing proteins like albumin to leak out. And that could easily go unnoticed. But luckily, albumin has a structure kind of like soap, which is why it creates this thick foam. Actually, this is a bottle of albumin that we use in the hospital, and you can really see how foamy it gets. Okay, now let's do a quick test together. This is something I do on almost all of my patients in the hospital. Roll up your pant leg, and then gently press your thumb into the lower shin bone for about 5 seconds. Then check to see if it left an indent. If it did, it's called pitting edema. And the reason this happens is related to the frothy urine. As you pee out albumin, you end up with lower levels of albumin in your blood. And albumin plays an important role in holding fluid inside your blood vessels through osmosis. So without enough albumin, fluid starts leaking out into your tissues, causing swelling. And this free fluid tends to follow gravity, which is why most people notice swelling in their legs and feet. Although it can also end up in loose tissue like around your eyes. But here's the problem. Even though you're swollen, you actually have less fluid circulating inside your blood vessels, and your kidneys assume that means you're dehydrated. So to try and help, your kidneys retain salt and water, which just makes the swelling worse. And that's a vicious cycle. In severe cases, that fluid can even leak out into the lungs, making it difficult to breathe. But before you panic, there are a lot of causes of leg swelling. A small amount can even be normal after standing all day, but that should usually get better overnight when you're lying down. If your leg swelling doesn't get better, or becomes more pronounced around your eyes, then it could be related to your kidneys, and you should get that checked out. Alright, now onto a common myth. I find that most people think that if you're peeing a lot, then your kidneys must be healthy and doing well. But when it comes to your kidneys, quality matters more than quantity. In fact, the first thing to go when your kidneys are struggling is the ability to concentrate urine. And this is most noticeable at night. Normally, your kidneys make concentrated urine overnight, partly because you're not eating and drinking, but also because of a hormone called ADH. So if you're forced to get up to go to the washroom multiple times at night, we call that nocturia, then it could be one of the first signs of kidney disease. Okay, now take a look at your nails, especially the color of them. It's normal to see two colors, particularly on the thumb. The lighter part at the base of your nail is called the lunula, which just means little moon, and you can think of it as nail that's still under construction. Now compare that with these nails of a patient with chronic kidney disease. They also have two different colors, but don't be fooled. That's not a normal lunula. And the other half of the nail has a reddish brown color. These are called half and half nails. Not everyone with chronic kidney disease will have nails like this, and we actually don't know why it happens, but there is a really clear association between those nails and kidney disease. Now let's switch our focus to phosphate. a mineral that your body tightly regulates and causes major issues when levels start to rise. We primarily get phosphate from our food. In fact, most of us get too much phosphate in our diet, but healthy kidneys can easily handle that. Although when your kidneys become damaged, they can no longer get rid of that excess phosphate, and so levels start to rise in your blood. And the reason this matters so much is because phosphate will bind to calcium, forming calcium phosphate crystals. And depending where they deposit in the body, they can cause a whole host of symptoms. When those crystals deposit into the skin, it's called calcinosis cutis. It usually shows up as whitish yellow bumps that are hard under the skin, and it's painless. Sometimes they can break open, and what comes out sort of looks like a thick paste of calcium phosphate that reminds me of toothpaste. Aside from kidney disease, you also see this in autoimmune diseases like scleroderma or dermatomyositis. So as a rheumatologist, I see this quite often. While these can be pretty awful for patients, in some ways, it's sort of best case scenario, because those same calcium phosphate crystals can also deposit inside blood vessels, and that can lead to a medical emergency called calciphylaxis. In those cases, blood vessels get blocked, organs and tissues don't get enough oxygen, and in severe cases, it can be fatal. But there's another, more subtle way that high phosphate can impact your blood vessels. Take a look at this X-ray. Yep, I know he's missing part of his finger. We'll leave that to ortho to deal with. What I want to draw your attention to are his arteries. You are not supposed to be able to see them that clearly on an X-ray. So what's going on? Well, your arteries normally have smooth muscle cells that can constrict and relax to control flow and pressure in the blood vessel. But when they're bathed in phosphate, these cells have a total identity crisis. They actually start acting like bone cells, laying down calcium phosphate into the walls of the artery. So the artery wall, which is typically stretchy, becomes hard as a bone, and you can actually feel it under the skin. The best way that I can describe it is it's sort of like a guitar string